The way I have told you in first video that how collagen is formed, first are microfibrous, then fibrous fibers and bundles. Okay, so in this way the collagen is formed. Now moving towards another topic, which is actually the principal fibers of periodontal ligament. So let's start it. Bismillahirrahmanirrahim. So we have six groups of principal fibers of periodontal ligament. Number first one is transeptal fibers, then alveolar crust fibers, horizontal fibers and oblique fibers, apical fibers or interradical fibers. Now one by one we will study about them. Transeptal fibers are interproximally over the alveolar bone crust and are embedded in the cementum of the adjacent teeth. So these are transeptal fibers. You can see I have told you that they interproximally means in the interproximal area or the bone. Okay, or the alveolar bone crust, it is embedded to the cementum of adjacent teeth. Okay, and then it has a property that it is reconstructed even after the destruction of the bone. It results from the periodontal disease. Okay, these are the only group of fibers that are from transeptal fibers. Okay, these are the only group of fibers that are reconstructed. We have also studied about them in the gingival fibers. So basically they are saying they are belonging to the gingiva because they do not attach to osseous attachment, means it is not attached to bone. Okay, then alveolar crust fibers, basically they are extended oblique from the cementum just below the junctional epithelium to the alveolar crust. Okay, then basically you can see here the alveolar crust. Okay, so basically they are saying that they are obliquely from the cementum, okay, just below the junctional epithelium, and then they move toward the alveolar crust. You can see here. Okay, now they are seen. These fibers run from cementum over the alveolar crust and then to the and the fibrous layer of periosteum then covers the alveolar bone. Okay. Second, basically, it prevents the extrusion of the tooth and resists the lateral movements during the like surgical removal of the tooth. These fibers do not actually do not let or do not move the tooth. It actually prevents the extrusion or extraction of tooth and resists the lateral tooth movements. The excision of these fibers during periodontal surgery does not increase the tooth mobility unless significant attachment loss has been occurred. Horizontal fibers, which is basically horizontal, they are actually extended at right angles to the long axis of the tooth from the cementum to the alveolar bone. Then oblique fibers, which is actually the largest group of the pedial fibers, they are also extended from the cementum in a coronal direction obliquely then into the bone. They basically bear the masticatory forces and then transform these stresses into tension on the alveolar bone, means these are helpful during the mastication. They distribute the force over the bone. Then apical fibers, they radiate in the irregular manner from the cement to the bone in the apical region, and they do not occur in the incomplete form roots. If they have asked you that which fibers or periodontal fibers, they are not present in the interior teeth, so they are apical fibers. Apical fibers are present in your posterior because for them you should have at least two roots. Okay, the interradicular fibers basically fan out from cementum to tooth in the furcation areas of multi-rooted teeth. Okay, now well-formed fibers interdigitate at right angles and splay around and between regularly arranged fiber bundles. They have told you about how these fibers are actually arranged. Less regularly arranged fibers are found in the intestinal connective tissue between the principal fibers because they contain blood vessels, lymphatics, and nerves. The periodontal ligament does not have mature elastin, so they have oxytocin and eloine. Okay, they are so called oxytocin fibers. They run parallel to the root surfaces in the vertical direction and then bind to the cementum. Okay, and in the cervical third of the root they are brought to regular vascular flow. This elastic meshwork actually has been described in the pedial. Okay, has been composed of has been composed of many elastin lamina and peripheral oxytocin fibers and alveoline fibers. These fibers shown to develop a new regenerated matlab they help in regeneration of the PDL. Okay, these fibers. These fibers are also remodeled by the PDL to the psychologic needs. Okay, according to the function, the PDL actually remodeled these fibers in response to different stimuli. These fibers have, in addition to these fibers, small collagen fibers which are associated with the larger collagen fibers have been described. Okay, with these they have also small fibers. They run in all direction and form a plexus. They are called indifferent fiber flexes. They are actually small fibers that are also present with these groups. Okay, they are called indifferent fiber flexes.